Hi friends, good evening. I'm Dr. Ashutosh Gupta and today we are going to talk about fibroids and pregnancy, right? तो बेसिक थिंग इज दिस कि जब नॉन प्रेग्नेंट यूट्रस होता है तो उसका जो वेट होता है वो तकरीबन 90 to 100 ग्राम्स होता है नॉर्मली. एंड व्हेन द मदर गेट्स प्रेग्नेंट एंड द बेबी गेट्स डिलीवर्ड 38 वीक्स तो यूट्रस का जो वेट हो जाता है वो तकरीबन 1100 ग्राम का हो जाता है. सो मीनिंग देयर बाय दैट इट इज अ 10 फोल्ड इंक्रीज इन साइज एंड द वेट from something around 100 grams to 1000 grams, right? So that happens because of lot of hormones which is there during the pregnancy, which is called as an estrogen. So estrogen does helps both in the hyperplasia and hypertrophy. जो मसल्स होती है वो नंबर में बढ़ भी जाती हैं और मोटी भी हो जाती हैं. तो चूंकि यूट्रस भी ग्रो कर रहा है तो उसी तरह से हम ये समझते हैं कि फाइब्रॉइड भी ग्रो कर सकता है. तो फाइब्रॉइड भी उसी ईस्ट्रोजन की जो मोइटी होती है जो कि नॉर्मल यूट्रस को ग्रो करने में मदद करती है उससे फाइब्रॉइड भी बढ़ जाती है. तो कभी हमने ऐसे देखा है कि द होल ऑफ द यूट्रस इज बीइंग सीडल्ड और देन देयर इज लॉट ऑफ फाइब्रॉइड इन द यूट्रस एंड देन द प्रेगनेंसी इज देयर. सो जैसे पुरानी डिक्टम है कि जाको राखी साइयां मार सके ना कोई. So we are going to see this thing with our own eyes. So this is 11 weeks pregnancy and this is the fetus. Now we try to count the number of fibroids. So एक दो तीन and चार in the posterior wall of the fibroid, चार पाँच and छः सात, and then we get into the retroperitoneal area and then in the posterior wall and then we identify कि we do have fibroids and then this is in the posterior wall. तो ये posterior wall के अंदर है and then this could be subserosal also. So and then it is in the posterior wall of the fibroid, posterior wall of the uterus. We are also seeing fibroids. So what I can count is this something around 11 to 12 fibroids in the and then we can see the placenta and then the fetus, right? So during the pregnancy, as the estrogen is available, so the uterus also grows. So does the fibroid, and where the fibroid also increases in size. So the tipping point is something around 5 centimeters. So any fibroid which is greater than 5 into 5 centimeters becomes a potential tipping point for a red degeneration. What happens is this that the blood flow into the fibroid comes from the periphery and then gets into the center, right? So it behaves like an myocardial ischemia, meaning thereby that the fibroid once it expands, जब फाइब्रोइड बड़ा होता है तो उसकी जो पेरिफेरी है वो कंप्रेस हो जाती है. सो चूंकि आर्टेरियल सप्लाई हैज टू कम फ्रॉम द पेरिफेरी टू द मिडल एंड देयरफॉर द सेंट्रल पार्ट ऑफ द फाइब्रोइड्स बिकम्स ischemic. वहां तक ब्लड सप्लाई नहीं पहुंच पाती है एंड देयरफॉर वी डू हैव दैट red degeneration. So there is a lot of different issues that probably we can talk about. So red degeneration is there, which happens with an acute pain during pregnancy and because of the rapid expansion of the fibroid during the pregnancy, and then we can have some calcification and all those stuff, right? But the thing is this: with these many fibroids, even though we can identify that the placenta is all good, the uterine arteries are absolutely good, the baby is absolutely doing good, and then we can expect a normal fetus going up to something around 34 weeks and 36 weeks because the fibroids would also grow and all those stuff, right? So this is a good case that probably we saw that we identified something around 12 fibroids and with the fetus. So meaning thereby those fibroids are guarding the fetus. They are like watchmen and looking around for the baby, right? Thank you very much for your patience.